Welcome to Chats with a Nurse, where we sit down and ask our nurses questions around pregnancy, body literacy, sexual health, and general women's health. Hey girl, welcome back to Chats with a Nurse. We're here with Tracy.
Hi.
Tracy, and we're talking all about your first trimester and what to expect.
Mm-hmm.
So if you just found out you're pregnant or you think you might be, the first trimester can be overwhelming, and it can be a lot because there's a lot happening in your body, a lot of changes. And so Tracy's here to help us break it down, and so we know kind of what to expect. So Tracy, let's start with the basics. What is the first trimester and what's kind of happening during this time?
Sure. The first trimester is the first 12 weeks of pregnancy. So some of those beginning weeks, a lot of times you don't even know you're pregnant yet, which can be tricky.
Yeah.
But it's the first 12 weeks, and lots of important things are happening for baby during that time.
Mm-hmm.
Baby's the smallest, but you're forming brain, spinal cord, arms and legs are starting to form, the brain, sex is starting to develop, all major organs. I mean, really everything with the baby is beginning to develop during this first trimester, even though they're super tiny.
Wow, that's incredible.
Yeah.
So what are some kind of common or symptoms that somebody might experience during these first 12 weeks of pregnancy?
Sure. You think of morning sickness a lot. We all hear about that. But really morning sickness it's just nausea, vomiting, and it can be any time during the day.
Yeah. Not just morning.
Not just mornings. A lot of people will have like food aversions or sensitivity to smells that may be new. Yeah. A lot of women complain about being fatigued, really tired during this time. You can have breast tenderness. So every woman's symptoms can be a little different, but those are some of the common ones.
I mean, I would imagine you'd be tired because you're literally forming a human being in your body.
Absolutely.
So that's taking a lot out of you.
Yes. And all those changing levels of hormones in your body takes a toll.
Yeah, absolutely. Yeah. What are some kind of next steps after you find out you're pregnant? You got that positive pregnancy test. Like, what are the next steps a woman should take?
Sure. As soon as you find out, we want you to start taking prenatal vitamins. Yeah. And if you're a woman that's trying to get pregnant, it's great to just be on a prenatal vitamin. And that way your body's like ready to go. Because in that small window of you're not sure you're pregnant, you've already got all those essential vitamins in your body ready to work for baby. So prenatal vitamins, you want to get in with an OB/GYN as soon as possible to be seen. A lot of times your first visit is around the 8-week mark. If you're having trouble getting seen, you can always come to a clinic like ours and kind of get started on that early prenatal care, get some good education. Yeah. And then you want to avoid things like smoking, alcohol use, anything that could be harmful to the baby. Right. And just take care of yourself. Be hydrated, stay hydrated, rest when you can, eat when you can. A lot of times it's hard to keep food down during that first trimester for a lot of women. So
yeah. Any tips on like what you can do to help keep things down or keep that nausea at bay?
Yeah, small frequent meals is usually what we suggest. Trying to have something kind of near your bed when you go to bed, like a little water and some crackers, because a lot of women will feel really nauseous when they first wake up. So it's nice to kind of put something on your stomach and have a little something to eat before you wake up so you don't get super nauseous or dizzy. But yeah, small frequent meals is probably the best advice.
Yeah, that's awesome. Thank you. So Tracy, what are some concerns or maybe some scary things that can happen during that first trimester? And when should a woman, reach out to the provider if they're concerned about something or if they're worried about something?
Absolutely. Well, one thing that can happen is if a woman unfortunately miscarries, which we never want to happen, but 1 in 4 early pregnancies actually end in a miscarriage. So that's, 1 in 4 is a high percentage. Yeah. So if you're experiencing any bleeding that's consistent and heavy, anything more than a light spotting, because some light spotting during early pregnancy is totally normal. Okay. But if it's heavy and ongoing, you need to reach out to a healthcare provider. If you're dealing with severe nausea where you can't keep anything down, and you're starting to get dehydrated,
Mm-hmm.
you may need to get some IV fluids and some
Right.
prescription medication for nausea. So those would be a couple things. And then just trust your gut. If you feel like something is not right, it's better to be seen and ask some questions with a trusted healthcare provider.
Absolutely. We say that a lot around here is trust your body.
Yes.
You know it best. You know what's normal, what's not normal. And so listen to what your body's saying, what your gut's saying, and reach out to somebody. You can even send us a question and we'll try to help you for sure. And know like every pregnancy is a little different.
Yes.
So it's, there are normal things, but then everybody is a little bit different. But knowing kind of what are some things to expect and what are some red flags to expect, it's helpful. So thank you, Tracy, for breaking that down for us. Catch you next time.